Hi there and welcome to Moms with a Mic. We're glad you're with us. We are talking about something that's on the minds of so many moms right now, and it's delivering during a pandemic.
And I actually just recently went through this experience, having had my son, my second child, really in the middle of the COVID-19 crisis. So we wanted to reach out, offer some advice and insight into what that was like for any moms out there. We know there's a lot of you who are going to be delivering fairly soon and have a lot of questions.
Yeah, so we hope this will help to give you some perspective. So, Marissa, what was it like when you first found out, whoa, I'm going to be delivering during a pandemic?
I mean, to be honest with you, what do you think at that moment? I mean, it is scary. There were so many unknowns. We didn't know what things were going to be like in the hospital. We didn't know how many people were going to be sick. We didn't know if there was going to be room in the hospital. So, yeah, definitely when all of this was first unfolding, it was frightening. I didn't know how it was all going to unfold. But that's why it's so important to talk to your doctor. I asked so many questions at various appointments to try to feel better about what the setup would be like. And once I did speak with them, time and time again, I really started to be more and more at ease about what the experience was going to be like.
And that's really a good point, because talking to your OB, of course, your obstetrician is delivering babies all the time, right? At your hospital, your obstetrician, your team of obstetricians. So they really have kind of the latest information for you. I mean, you could ask your OB, what was it like just last week? You know, what are there changes now? Because changes can, happen often and be difficult to keep up with. So really, that's a great source of information, because your doctor obviously has rights to the very place where you expect to deliver. And that's, of course, the hospital or site that you want to know about, because that's where you expect to be.
That was my major concern, speaking with my doctor, that the labor floor wouldn't be overrun with COVID-19 patients, that we would be separate. And they assured me over and over again over the course of several different appointments that we would be separate, that we would be essentially in a wing that was locked off on a different floor, nowhere near the emergency room or the ICU. So that gave me a calm that I didn't have before.
And I think that's a lot of what moms-to-be are worried about, right? They're worried about, am I going to get infected when I go to the hospital? I think, people are worried about the risk of going to the hospital. So that is a great question, again, for your obstetrician to help set you at ease and understand, where the delivery room is compared to the rest of the hospital, and just generally what the risk is.
And really, once we ended up in the hospital, and I was in labor, everybody wore that personal protective gear. I mean, from the full-on gowns and more than one mask. Everybody wore at least two masks, sometimes a face shield, which really made it interesting, because all the nurses who took care of me, I only ever saw their eyes. Of course, my husband and I went in wearing masks. And there were times where I didn't have to wear a mask, and then times when I did wear a mask, which I'm sure that's different for every hospital. So moms out there, you'll want to ask what the particular policy is at your hospital. But as far as contracting the virus in the hospital, I actually never worried about that, because I know that the people that are taking this the most serious are medical professionals. They're going to be wearing their PPE. They're going to have their distance unless they have to be right on you to help you out. I know that they're there to protect themselves and us first and foremost. So I was never really concerned. It's not like being out in a public place where you might run into somebody who's not taking it seriously. The people at the hospital are taking this the most serious for themselves and for you. So really, that was never a concern of mine. I was worried there may not be room. I was never worried that I would actually get sick in the hospital.
What about after Luke was born? How did you feel about his safety and your safety at that point?
Again, everybody that was handling him, full-on protective gear, I felt like he was totally safe. I felt like I was totally safe. I was really in the best possible hands, because again, I know these medical professionals are taking this very seriously. He was just down the hall. I got to see him just as often as, when I had my daughter. But for moms out there that have never been through this experience before, I understand a lot of the unknowns.
Sure.
And then this just introduces so many more unknowns. And I think that's why it's so important to express that to your doctors, because they can really set your mind at ease. Because you're not the only one worried out there. I mean, we know there's a lot of women concerned. So ask the questions. The worst thing you can do is keep those concerns to yourself. Talk to your doctors. Talk to your spouse or your partner, because they're going to be there right there with you and be able to ask any questions that maybe you aren't able to.
I would say talk to your midwife, if you have a midwife, if you have a doula, about these things. These are experienced professionals. One thing I learned in giving birth was the importance of the support from your partner or a family member or close friend who is going to be there in the trenches with you. If they can help share some of that burden and kind of prepare to reassure you, that will help settle you, especially with the unknown like you're talking about.
And also, a lot of times when you go to the hospital, you're not exactly in your right frame of mind, right? You're huffing and puffing possibly, or
it doesn't feel real.
You're talking about, or thinking about all the other things that you have to think about when you go into labor. So yes, to make sure that your partner and your doctor, that you've had the conversation beforehand to know what to expect.
One thing I know that was difficult from our perspective as a family when you delivered is that we couldn't be there to meet Luke as he came into the world. So that was tough on a lot of us, but you said there was also a silver lining to that.
Yeah, as much as we would have loved to have everybody there while we were in the hospital, it was comforting to know that there weren't just random people, other visitors visiting other patients just up and down the hallway, knowing that literally the moms and their spouses were the only ones in the hospital, that it was really restricted as far as visitors. It was a relief to know that you couldn't just have people walking around the hospital possibly carrying the virus. So that made me feel a lot better.
And then what about coming home?
It's funny, you feel like you're quarantined anyway when you have a newborn, because you don't really want to take them out. They haven't had all their vaccinations yet and different shots. So for me personally, being home with the baby, it's actually been very nice to be happening during this time, because I don't miss being out so much, because I would be home anyway. But it's been wonderful. Again, it's been a little tough that the family hasn't been able to come over as much as I would have liked. But on the good side of that is that our little core family has had a lot of special time. Me, my husband, our daughter, with our son.
Great bonding time.
Yeah, great bonding time. It's just so special, and when are we going to get this again? So really, you just try to look on the bright side of everything, and there is always a silver lining.
Well, thanks so much for joining us for our chat here with Moms on the Mic, and we wish you a wonderful delivery if you're an expecting mom, and we hope to be with you again soon.
And just think that bundle of joy is headed your way, and once he or she comes into the world, everything else will just melt away. So take care of yourself, take care of your family. Thanks for watching Moms of the Mic.